Hi there. Thank you once again for joining me on the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. We continue to discuss the COVID-19 pandemic as it continues to wreak havoc across the world, not just in Guyana. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. Most days you would see or hear me talk about my mask being worn properly. Now, to put on the mask, you have to take the straps and then put it over your nose and the mouth to cover both places. And the same thing, when you're going to take it off, you use the straps to take it off as well. There's no one close to me as we are recording this program, so I'm putting nobody at risk by taking my mask off. And there is certainly no one here who is putting me at risk. So we're continuing our talks about COVID-19. And I want us to spend some time discussing what's happening in Guyana. We're at the end of April 2021, and it has been a very difficult month so far. It's not yet ended, but we have lost a number of patients who are COVID positive. And so therefore a number of families are in mourning because they have lost a loved one to the COVID-19 pandemic. There was a period when Guyana was seemingly under very good control, that we have ridden out the worst of the storm. But March and April has brought with it renewed increasing numbers of infection and increasing numbers of persons who have died. We have not yet come out of this storm, and it is up to all of us to do our parts responsibly in order for us to get out of this period here. The simple things remain true. We need to continue wearing our masks. I know a number of persons have gotten their COVID-19 vaccines already, and that is great. In fact, I believe over 125,000 persons would have received vaccines already. And this is across all types of vaccines that are available in Guyana. But despite getting vaccinated, it is very important to continue wearing your mask. And why is that? Because even though you are vaccinated and you might be protected from severe infection, you can still get mild and moderate infection. But worse is the fact that you can pass it on to someone who may not have yet been vaccinated, or someone who is at high risk with underlying conditions, etc., diabetes, hypertension, heart disease, cancer survivors, HIV, immunocompromised people. These are all people who are at high risk. And even though you might be vaccinated, you can have the infection, a mild form of the infection, but you can still pass it on. So we encourage and we continue to advocate that people who have received their vaccines continue to wear their mask. The second important thing that we continue to advise is that people continue to sanitize, wash hands as often as possible. And then the most difficult of the lot to accomplish is social distancing. When we say social distancing, we mean to be at least 6 feet apart from people, especially people who are not in your immediate circle. So sometimes that is very difficult to achieve, but we still encourage and advocate that you give your best effort to get that done. And we stay home as much as possible and avoid unnecessary traveling, unnecessary contact with others. We know that it's almost impossible to just lock away in a house forever, but we have to make an effort to ensure that we minimize non-essential human contact and non-essential traveling, etc. At the end of April 2021, we have experienced in Guyana a tremendous number of persons losing their lives. So far, we would have recorded positive cases of over 12,800 persons testing positive. That's 12,800 persons testing positive. We have had 291 persons unfortunately losing their lives to the COVID-19 infection. The silver lining is that we have had a very good recovery rate of 90% plus, and we have over 10,900 people who would have tested positive and recovered safely from the COVID-19 infection. Now, when we talk about recovery, we usually mean immediate recovery out of grave danger. But many of these persons continue to live with long-term effects of COVID-19. Not just physical effects, but also mental effects. The physical effects can range from chest pain, shortness of breath, fatigue, muscle aches. These are all things that survivors of COVID-19 are complaining about. Not every survivor, but a significant number of COVID-19 survivors. Lots of these patients may have scarring to their lungs, and it therefore makes it difficult for them to breathe normally. And it's important for us to remember that these patients, even though they leave hospital and they're discharged and they're considered to be recovered, they may still have long-term effects. So that's just one of the many ways in which they can be affected by having lung scarring. A number of these persons also have mental or psychological issues that have resulted from this COVID-19 infection. Some persons have complained about having a constant heaviness in their head. People can't sometimes sleep properly. They either have difficulty falling asleep or difficulty maintaining sleep when they fall asleep. Some people wake up earlier than usual in odd hours of the morning and find it difficult to fall asleep again. Many people still carry around an anxiety and fear complex, that they're worried, and they carry around a memory of what they might have seen in hospital if they were admitted to hospital. It's almost like a post-traumatic stress disorder for soldiers who are returning from war when they experience tragic numbers of people dying in front of them. It is very similar for the COVID-19 patient, especially those who would have been admitted to ICU. When they leave there, many of these persons, although they are grateful for being discharged from hospital, they still carry around psychological scars and burdens that we don't know yet how long these will last and stay with them. If you look at the graph for active cases in Guyana, we can see very clearly that we had two peaks previously of active cases. The first one was around September, October 2020. And that is probably due to increased testing at that time. But the second peak that occurred in January, February of 2021, that one is most likely to have resulted from activities around the Christmas time, the holiday season, etc. The biggest concern, however, started in March of this year, where there's been a steep increase in the number of positive patients being revealed. These numbers have been quite dramatic. Many days we have gone beyond 100 positive cases, and we see that the graph for number of positive cases and the peak is not yet defined. We are hoping that we have reached the peak and we are now going to start coming down from this high, but so far it is too early to tell. We can hope, but we have to actually take actions to make sure that our hope is realized. And the actions are quite simple. It's the same thing we've been talking about all the time. Wear your mask, wash your hands or sanitize your hands, maintain social distancing. And now if you have the option and the opportunity to get vaccinated, please, I recommend that you should. There is only one group of people who should be cautious and not take vaccine. And that is the group of persons who are known to have anaphylactic or severe allergic reaction. Every other person should be open to taking the COVID-19 vaccines. Across the world, all the authorities, the WHO, the CDC, the European guidelines, they have all been holding the same position, that the only group that should absolutely not take the vaccine are those who have severe allergic reactions to these vaccines or previous vaccines or any component of these vaccines. Everybody else should consider taking the vaccine, especially if they're in a high-risk group. If we look at the coronavirus deaths or the corona-associated deaths in Guyana, we can see again a sharp rise in these numbers from February 2021. The early days from February 2020 until August 2020, there were less than 10 deaths. But it started to increase. We got to 100 deaths in about October 2020. We got to 200 deaths in February 2021, and we are almost at 300 deaths in the ending of April 2021. So we see a sharp rise in the number of deaths or the average deaths as we got to the end of April 2021. This is very alarming and this is very worrying, and we suspect that we have not yet seen the worst of these numbers. As I'm talking to you today, I want to give you a brief summary of what actually is the reality in the COVID-19 hospital at Lilliendale. We have right now a total of 49 patients in that COVID-19 facility at Ocean View Lilliendale. 13 of these patients are in the ICU. Fortunately, none of them are intubated and hooked up to a ventilator where the machine breathes for them. But 12 of these patients are on what we call CPAP, continuous positive airway pressure. This is a machine like a mask that is hooked up on the patient's face that essentially covers nose and mouth and is strapped tightly to maintain a vacuum seal. And air or oxygen is pumped directly into this mask at high pressure. So then that is transmitted into the patient's lungs so that high pressure oxygen is delivered to these patients. It is an uncomfortable thing, but it sometimes is necessary for it to be done. It is a step sometimes before actual intubation and putting patients completely on a ventilator for the machine to breathe for them. The one thing that I want to highlight to you today, since February when we started our vaccination program, there were 95 admissions to the COVID hospital. That is 95 people admitted since the end of February when we had commenced our vaccination program. Of those 95 people, there were only three that had received vaccines, and all three of them had their vaccines less than a week before admission. It means, therefore, that these three people did not have sufficient time to develop their resistance and their antibodies to the COVID-19 virus. Unfortunately, they may have already been infected when they got their vaccine. But I pointed this out to let you know that the vast majority of the people who are admitted to hospital are people who did not get their vaccine. And the data around the world from all of the vaccines, not one or two, all of the vaccines, they have all shown to be 100% effective in preventing severe COVID. 100% effective. And when I talk about severe COVID, I mean admission to ICU, being put on a ventilator, or dying. I hope that this would have encouraged you to go and get your vaccine, because the majority of people are eligible to get vaccines. And if you have any questions or comments about anything to do with COVID-19, we will try to answer them. Please feel free to send a WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. Thank you once again for joining me.